Good evening to all of you. It's good morning to people of my friends who are in USA, or in afternoon to the people in Europe who may be watching this. I'm trying to condense 15 years of this work into 45 minutes. So I'm going to go a little fast, but you will have the slide deck later. You can, and also the publications. So Metadicol is about how do you target many diseases with the same product. Just a disclaimer, it's a nutrition supplement. So, please talk to your doctor about it. I have to do that. My legal counsel tells me. So we sell it under three names. Nanosoma, it is sold in India as Nanosoma. Nano Ojas. Ojas means the power of life in Sanskrit. Soma is the elixir of the gods. And Metadicol in Southeast Asia. All my publications are available at researchgate.net or academia.edu. You can download the PDF and all the patents in many languages. All the work I report is done. We are a virtual company in a sense because all the work we do, we give it to outside parties. So there is no inherent bias in the result I get. I have not done any work here other than to give the sample to different labs, established labs around the world. This is our patent coverage. It's pretty much patented all over the world, 80% of the world's population. And this is where it is sold right now. In India, we sell it at Nanosoma in our offices in Bombay. Mr. Murali Sharma is in charge. You can visit his website here, nanosutra.com. So I just want to talk about the state of medicine today. We have progressed so much today, which was set 50 years ago, that there's hardly a healthy human being left. And this is the advances in Western medicine in the last 30 years. And we have not really done a good job. And you see, we have all these drugs here. So if, like diabetes, you have 120 drugs. If one of them worked, then the other 119 are out of business. So obviously, if you look at this, the simple explanation is that we're doing something wrong. And even take statins, for example. People talk so much about statins. This is a study of, I put together all the trials done in the world. There's no difference whether you take statins or not. It doesn't make a difference in your life. I just call it a case of expensive urine. So we are the authors of our own health or disease. This is what Buddha said. And even Ayurveda says, when the diet is wrong, medicine is of no use. When the diet is correct, medicine is of no need. So Metadicol, the anagram means methodical. It's an approach to health and wellness. So this is a journey for me from the bitterness of disease to the sweetness of health. This is what Hippocrates said. You know that most of your doctors know. And the problem today is that most of the cells in our body are not human genes. They are bacterial and viral genes. We have 90% of genes of bacteria, viruses in our gut and mouth and so on. 7% of the genes we are called junk DNA. We don't know the exact roles. And only 3% is human gene. This is the focus of our medicine today. We ignore the elephant in the room. And for every human gene, so-called human gene, we have 360 microbial genes. So if you calculate, you will find that there are 7.2 million genes we deal with. And when the pharmaceutical company says, we targeted this gene and that gene, the chances at 99% accuracy is 1 in 72,000. So the question we ask is, if there are hundreds of drugs for one disease, why not one drug that will target many diseases? And this is where Metadicol comes in, the history. There was a physician in Dutch East Indies who found that when he gave polished rice to chicken, they got polyneuritis. But when he changed the diet to unpolished rice, it went away. And what was removed was actually Metadicol, which is called polycosanols. And this is a wax. It's very hard to dissolve. That's why it has not been effective. And it's present in many of the foods we eat every day. We don't even know this. These all contain polycosanols: sugarcane, grape, rice, and so on. This is the major constituent of polycosanol. The C28 is the key ingredient here. It's in every food that we eat, and even plants in the world. The bark of the tree, for example, contains polycosanol. But there is an Indian history connection to it, which is what has inspired me. This is a temple in South India called Vaidishwaran. That means in Tamil, doctor's temple. The mythology of the temple is the people worship Jaggery. I've been there. And it cures, believed to cure 4,448 diseases. Now, remember this number. We'll come back to this later. This is how we produce it. We get the products from all over the world. and it's all assembled in Switzerland. If you look at the picture of this factory, behind the factory is actually Italy. We crossed Italy. Sometimes you go for lunch just by crossing it. So we make 3 products: the gel, the cream, as well as the spray. This is what the spray looked like. Hold on. This is a simple bottle. So the way we do it is to spray anywhere. That's how we administer the product. These are the 3 products. So I want to go into the applications in disease. We made this into a water-soluble product. So it's a size of 53 nanometers, half the size of a human virus. And we have published this work. It's in our patent. The rat study, it increases blocks TNF-alpha, increases glutathione, increases vitamin C, which has not been seen before, decreases insulin resistance. A lot of this, you can check it in our patent. But the important thing with these biomarkers is once you target them, all these biomarkers, then you get access to mitigating a lot of diseases. So one of the first things we did way back in 2010 was actually in Bangalore, in Jain Hospital in India. We took a look at 15 metabolic syndrome patients who had diabetes for maybe 25, 30 years on an average. And the first thing we noticed was that their blood pressure became normal within 3 weeks. Some of them, in fact, experienced blood pressure reduction overnight. That's how we came to know. And then we looked, the fact that you get high p-values even with an open label study means it affected everybody. And if you look at it here, you can see that everybody's blood pressure dropped like a rock. Within a matter of 12 weeks, they are all normalized. And we also have done another 30 patients, which are not hypertensive patients, but they also saw a reduction in systolic blood pressure. Why is it important? Because for every 2 millimeters decrease in blood pressure, you can have a 7% reduction or 10% reduction in mortality. And if you look at all the drugs in this world, none of them even reach those levels. These are drugs you take for, in this case, for example, 42 months, you barely had a drop in systolic pressure. Yet we use them. And one of the ways to do it is to compare our work with the UKPDS study, the United Kingdom Prescription Drug Study, where they gave 3 or 4 drugs for diabetic patients and look at the hypertension. And they did it for 10 years. And what they found was that there's a direct connection between diabetes and systolic blood pressure. And this is what they came up with. So if you decrease your blood pressure by 10 millimeters, you have a between 10 and 20% decrease in many of the mortality factors. So when you compare our product with the 10-year study, we can see that we reach the target within 12 weeks. This is sorry. And we also see here, for example, the cholesterol ratios improve. Total cholesterol doesn't change. In fact, we increase LDL. I'm going to tell you why later. Triglycerides go down, HDL go up. The key thing is not LDL number. It's the size of the LDL particle. And the way you increase the size, when you increase the size of the LDL particle, it behaves like HDL. So in this case, the only way you do this is to reduce the triglyceride and increase HDL. And if you look at the graph on the left side here, the diabetic scale here, as this comes below 1.3, the LDL becomes bigger. So you can have an LDL of 200, but if the particle size is big, there is no issue. Inflammation decreased, antioxidant level went up. In fact, we are surprised to see the increase in vitamin C because we are not giving them vitamin C. And globulin levels went up. We saw weight loss. In fact, one of the people in the study lost 15 inches of waist. So people who are more obese tend to lose faster than those who are less than 28 BMI. It takes a little more longer. And why is insulin resistance important? Because once you tackle insulin resistance, then you tackle every known disease in man. This is the key. Insulin is very important. And we see decrease in CRP. You compare it with the so-called statin drugs, which take years and hardly change the CRP levels. We are able to decrease CRP levels tremendously. And IVIG, which is globulin, we produce in the body. This product produces in the body, and this is an immune modulator. So, you are producing your own immunoglobulin compared to getting an injection, and the body will know what to do with it. We also noticed that there was an increase in the beta cell function. We had an increase of 63%. This is in our patent, you can read it. And there was a decrease as far as the UKPD study is concerned. So we decided to take a person, this person happens to be of the royal family in the Middle East. His doctor used to see me every day. He was detected with diabetes. And every day I used to get the data from him, and we collected the data over an 84-day period. And you can see that his all his levels went down. Fasting glucose, you can see the fasting blood sugar here. It dropped from 300 to 92, but the 2-hour breakfast, which was 500, which is pretty close to getting a coma, dropped down. Overall, he was normal. Okay, this was the level of drops in each of those time zones. And his HbA1c, A1c also came down. So if you want to cure diabetes, this is what you need to do. You need to target MCP1, which our product does through at least the rat study. We increase adiponectin, we block retinol binding, we block TNF-alpha, IL-6, CRP, PAI1, ICAM. You have to target all of them. So if you do it from a Western, so-called Western medicine, you will have to have 6 or 7 drugs to do this. And one of the interesting things, which is, we have not published this, but I'm just getting interested to you, is a patient we have followed for 400 weeks. He was a type 1 diabetic. He started producing insulin. The reason we haven't published this work is because we don't see C-peptide. So there must be, a body must have another way of producing insulin. But over 400 weeks, you can see his sugar level stabilized. We also done another patient here in China, and you can see her blood glucose come down. And we also did a challenge test with 75 grams of glucose. And at week 40, when we challenged this, you can see the blood sugar didn't shoot up. She took glucose, it didn't shoot up. So obviously she's producing her own glucose, and her insulin uses also went down. And insulin resistance is pretty good. And this is a patient we was newly detected, but actually within 12 weeks, her insulin went back to normal. We've seen many of these cases. So I just want to focus a little bit on vitamin C, because vitamin C is key biomarker. You see, other than human beings, chimpanzee, orangutan, and guinea pig, every other species produces vitamin C. The reason we can't produce vitamin C is because if you take glucose, and you see here, you have an enzyme we need called gulo enzyme. This has become inactive in us and primates for the last 40 million years. That's why it doesn't go to ascorbic acid. If you could do this, then you could use any amount of sugar, convert it to vitamin C. And we have seen that metadicol increases gulo in mouse cells. We have tried this in human cells, but we did not see gulo expression, which means our gulo is completely mutated. Why is it important? Because animals that produce vitamin C don't get heart attacks. And this is because human beings have something called lipoprotein A, which we don't need. Which we should have, we don't need in our blood, but it's still there. The enzyme is still working. And we did check with 4 insulin-dependent patients, and we can reduce their lipoprotein A. So this is why in India we have heart attacks, the high level of lipoproteinase. And the vitamin C levels also went up in these cases. And the reason how vitamin C is recycled is because we express GLUT4 genes and also increase in insulin receptor genes. Here you have GLUT4 being increased. Here you have GLUT4 being increased. Oxidized ascorbic acid gets into the cell and is recycled. And you know that we have increased GSH we saw in the rat study. This is how it's being recycled. You don't have to give vitamin C. And if you take orally vitamin C, you can take 1,000 milligrams, but it doesn't achieve levels more than 1.4, very rarely. And we have done the 2 case studies where we have seen that people who are non-insulin dependent diabetic patients, 100% increase, whereas with people who have serious of health condition, normal people like us, who may have minor health conditions, it goes up 280%. Now, what happens when the body produces its own vitamin C? You can see this person in our study had a 1800% increase in vitamin C. And immediately HbA1c came down from 12 to 7, fasting glucose, body fat improved, triglycerides came down. So did muscle mass increase. There's another patient who had a 2000% increase in vitamin C. The fasting level came down and the fasting insulin came down, which is important because this is how you cure insulin resistance. And here's another patient who went up 1400% increase, and the HbA1c went from 9.9 all the way back to 6.2. Now I want to focus on a few skin diseases. Here is a person, we can improve the lines by using our gel. You can also use the spray. This is after 2 weeks. It's in our patent. This is a person who used a cream, and you can see how the skin contour, skin improved. You can spray on your face. You can see all the dots disappear. Acne in 8 weeks. This is one of the interesting cases because this woman had psoriasis for 80% of her body for 44 years. And guess what? In 12 weeks, she was back to normal. This is people with psoriasis. You just spray on the area. Within 12 to 16 weeks, it's all resolved. This is psoriasis of the hand in 4 weeks. People who have a diabetic foot injury which don't heal, because people who have diabetes, when they get injuries like this in the wound, diabetic wounds don't heal. Within 1 month, it was restored. This is a person with nail psoriasis, 24 weeks. You can see she has entire body but psoriasis. It all went away. Eczema in the right hand, 8 weeks. She tried for 10 years and nothing happened. And this was one of the most interesting cases we did. This lady had a disease, I don't even know what it was, from birth. And we restored her. She restored herself using our product in 24 weeks. And she's sharing it with the rest of the world. She's in Canada. And we can also use it in wound healing. For example, here the leg that was amputated, they started using the nano spray. And within 4 months, you can see the healing. This was a burn injury. You can't even see where the burn happened. Very quickly, it went away. This is an MRSA infection, which normally takes a year to resolve. Here it is resolved in a matter of days or weeks. And this is a carbuncle wound, cluster of boils. You can see the healing of the skin. Herpes on the back. You can see how quickly it healed. This is in the eye. You can spray it in the eye, by the way. You can see with the 3 to 4 days, we can resolve this. We can even grow hair. I mean, we have found this, especially men below 55 tend to get hair back, And this is for women, it's much faster. We have found across the board. This is a woman in Bombay, courtesy of Dr. Murali. Where you can see how quickly the hair grows back. This is a cut and a scar stitch. There are 20 stitches. How quickly, the scar disappears. We even done dogs. This is from an animal, Mariana Gonzalez from Arizona, from Colombia. She has a horse farm. She sent this to me. 8 years, the skin disease in the horse gone within a matter of weeks. I just want to briefly touch some of the other things we do. Thyroid, for example, this is a person who had Hashimoto and the TSH became normal. The normal TSH levels that you're healthy should be between 0.8 and 1.2. This is our finding. The antibodies decreased. He had no thyroglobulin, and we restored it back in 36 weeks. His T4 level, T3 level all became normal. And here you have a person with lung cancer, female person, TSH levels going down. By the way, it also works with hyperthyroidism. Here is a woman who used the product. TSH level normalized, came down, went up from 0.6 to 2.9. Then she stopped using the product, and all of it was normal even after she stopped it. This is a RA factor patient in Bangalore, a good friend of mine. He passed away recently. His CRP level was over 80, and it dropped down to normal levels. ESR also came down, but more importantly, the RA factor came down within 6 months. And his bone density revealed that he had now bones of a 35-year-old. We have the data with us. This is a recent case, courtesy of Murali Sharma in Bombay, his nephew, I believe, a relative of his. This person had fever, and then doctors gave some antibiotics, and he was rushed to hospital with liver failure after he took the antibiotic. Must have been a reaction to the antibiotics. His alkaline phosphatase shot up over 2,000. And his father flew down to Bombay, courtesy Murali Sharma. And when he went to the airport, dropped off the sample, they took the sample, he went back on the next flight back to home and started using the product. And you can see that within 30 days, his bilirubin improved, his AST levels were way through the roof, and so was the ALT, all became normal. This is how we have seen this in many patients that happens. Here's a person with liver elevated enzyme. This was from our people in Malaysia, which we get the reports from them. You can see huge levels of ALT and normalized. It took a little longer because she was also a kidney failure, which is also working on. This is a study of, we have not published this work, it's in our patent. He was waiting for a kidney transplant, and his PTH level came down over 48 weeks. His creatinine level was very high, it was a 10, but at the 44th and 48th week, it dropped to 1.1, and his EGFR went back to normal. And this person on the 52nd week was able to get a kidney transplant donor. And he died last year. He lived 10 years after the kidney transplant. And then he took a vaccine, which killed him. We'll come back to the vaccine story later. We have done with cancer. This is pictures I got from Dr. Anand Dey in Bombay and Murali Sharma. This is a patient who was on breast cancer, no medication other than our product. And you can see the column here that 15 weeks, all the parameters were normal. Here's a case of lung cancer. This lady couldn't go for therapy because of COVID restrictions. So she used our product. You can see pretty much it's cleared up. And this is a liver cancer. This I believe this was in September 2022. This was in August. So not August, July. So about 8 to 10 weeks. This is a patient from my friend Dr. Bari in Italy, Giovanni. He had face cancer and all kinds of issues. So my doctor took care of him, just gave him metodicol free from problems. Today, his blood analysis is normal, type 2 diabetes is gone, HP, the liver is improved, and facial cancer, I think the photos tell the story, as he says. So we have seen many of these happen. And this is the patient, MDS is very good for people who have low WBC or neutrophil count and platelets. It works very quickly. And here we did a study where we showed that as you increase the concentration of metodicol, it kills the leukemia cells also. It's very toxic to cancer cells. And I come to the infectious disease part of it because the fact of COVID and nonsense. This is how we got interested in COVID. In 2014, when we started marketing Malaysia, there was dengue there, like in India we have. And Dr. Tang, who should be in the audience listening, he offered this to 3 people, but only this girl took it. It was called Polylex in Malaysia at that time, and she survived. So I knew it was working in infectious disease. And he also found this lady who had TB, was coughing for 3 months, hospitalized for a month, and within 3 days, the coughing stopped. So, we can do something with TB here. We tested this in a lab, University of Virginia lab, and at 100 micrograms, nothing grows. We have also tested this at in Madras, and it works on XDR, MDR. Dr. Anand Dey, who should be listening in the audience, and Murali Sharma have done a lot of cases with TB patients in India. We are hoping to raise some money to do a large-scale TB study. We can eliminate TB probably very quickly within 6 months. Once you stop the cough, the spread of the germs will stop. And Dr. Anand Dey has tested this in Bombay, and the patient is amazed at how coughing stops within 2 to 3 days, and all the patients improved within. We're talking a small number, 2 weeks. And this WHO is a list of all the diseases that were are dangerous in the world. We have tested this against Pseudomonas aeruginosa, which is supposed to be the deadliest one, and our product kills it and neutralizes it in no time. This was done in Italy. These are all the things that threaten mankind. We have tested against all of them in vitro and some of them in vivo. So most of them can be handled very easily. And this is a short summary of all the things we have tested against. I don't have the many more bacteria we have done more recently. It works against viruses, all the viruses, including COVID-19, by the way, parasites, gram-positive bacteria, syphilis, gonorrhea, even TB and malaria. So this is where I come to this question of COVID-19. The name was given in 2020, but look here. In 2015, somebody filed a patent. We talked about system and method for testing COVID-19. So how do you file a patent in 2015 for a disease that didn't exist? Obviously, this was, somebody was planning this. These are all patents by various US companies for SARS-CoV-2. If SARS-CoV-2 is natural, how can you patent it? So, you know, something is not kosher here. And this is even more interesting. This is from the World Trade Council. You see here, in 2017, India imported COVID-19 test kit. Somebody in India did. I don't know who. That's 5,069 kilos. So people are already testing COVID kits in 2017. The disease was not known. And they were importing and producing this. This is from the World Trade Council. So obviously, this whole thing was a planned operation. It was not pandemic. There's no risk of death from COVID. The COVID people died because they used masks. They used, they were given oxygen, and then they were given remdesivir. This is how we kill. This is basically what is going on as genocide, in my opinion. And this is a clear case here. In Nicaragua, they did nothing. No masks, no drugs, no nothing. Nobody died. Very few people. And in Salvador, neighboring country, and Honduras, look at the death rate. This is from Africa. The countries in blue, they use ivermectin. Nobody died. Well, very few died. And the guys who didn't use it, you see what happens. This is from Robert Malone, who was the inventor of the mRNA vaccine technology. This is the status of what has happened with the vaccine. In my opinion, basing knowing all the people I know in the US, it causes cancer, it causes myocarditis. And if you look here, all the vaccines till 2020 caused very few deaths. The day they started this nonsense with COVID-19, look at the increase in death rate. My estimate, conservative estimate, is 13 million people have died. The press never reported it. And in the US, I know, living here, people are getting turbo cancers. I know friends of mine who got turbo cancers. They were from nothing for stage 4. Press doesn't report it. So what's going on is denial of facts. And, you know, if you're taking vaccines, you must look at these facts. Most of the people who died, 95% of people who died in UK were those who were triple and double and triple vaccinated. Oh, shit. So clearly there's a need for a better solution. And we published this work. This paper, every journal refused this paper for 2 years. They refused to even look at it. Finally, in 2022, we got it published. And here you see our product is so potent against the so-called virus. And I don't even believe viruses exist. Will come. These are probably exosomes in our body. 1,000th of the spray I took kills 90% of the virus. And everybody who took this product in India during the COVID, Mr. Murali Sharma will tell you, Dr. Anand will tell you, never got COVID. And how potent is it? Compared to remdesivir, is 2,000 times more potent. And even compared to, let's say, where is ivermectin? It's 6,000 times more potent. So ivermectin is very good. Ours is even more potent. And all you have to do was, if your vitamin D level was high, you would have solved the problem right away. All you have to do was go stand in the sun in Bombay, produce enough vitamin D. The beggars in Bombay didn't get COVID-19. Dr. Anand will tell you. And this is what you need to do. This is how we differ from vaccine. Louis Pasteur said, if the germ theory was, he would have vaccinated the fish. This is his game. But all you have to do is to clean the tank. This is what Metadicol is about. You improve your immune system. And this we can show here very easily how it improves the immune system. This is a dark field microscopy of a patient who has the Epstein-Barr virus. She takes nano. Within 20 minutes, you can see how the clumping has all gone away. There's another patient who had diabetes and also has Epstein-Barr virus. You can see this improve within a matter of 20 minutes. And this is what everybody in India should know. This is sent by a patient of our doctor, of our friend of ours. This is what happened when people get the vaccine. And a lot of funny things begin to form. I think it's graphene oxide, which is one of the main constituents. And this is what causes myocarditis, cancer, who knows what, because your body goes into overdrive, there's a cytokine storm and so on. Within 2 weeks, it clears. And this is why I don't care if you use anything else. If you have taken a vaccine, do this in 2-3 weeks, it's gone. Remove it out of your system. You save yourself. This is basically what it does. It's a lipid. So if against a microbe, it goes into the lipid layer and destroys it. And that's how the viruses or bacteria die. It's a very simple concept. So can we reverse aging? This is the next favorite topic for a lot of people, even in this thing. This has all been all over the place. I think we can do this. This is the telomeres. And as you age, the telomeres become smaller. And you need to put the telomere back, for which you need telomerase, which is the enzyme. And why is it important? Because it affects every known disease in man. And we have shown that at 1 picogram, 1 picogram of our product is 12x in homeopathy. We can increase telomerase 16-fold at 1 picogram. So homeopathy is probably real, at least under our conditions. And this is my own telomerase. It was 0.88. It became 0.19. I've been using for 15 years. So this was a couple of years ago. Today, I did one last week. It is now, I'm down to 48 in terms of biological age. My telomerase is now 0.994 rather than 0.99. So we can reverse aging, not chronologically, but biologically. There's another gene called Klotho, which determines how long you can live in life. And you can see here, Klotho, cancer cells lack Klotho. And the best way is to have Klotho supplementation. There are a lot of companies trying to make Klotho protein and inject it and so on. We express Klotho. We took cancer cells. We also took stem cells. We took somatic cells. We increased Klotho tenfold in fibroblasts. So we are reprogramming the cell to produce Klotho. So basically, we take cancer cells, we give our product. You see why cancer works now? Because our product tells the cancer cell produce Klotho. Klotho in turn kills the cancer cell. It's a very interesting way. We can also, our product, NF-kappa B. NF-kappa B means, you can decrease senescence, increase proliferation, reversal, aging gene expression programs. And this is the other theory of inflammation. We block both TNF and alpha, so you can reverse anti-aging. And this is a guy who got the National Merit Award for Science, 1997 from President Clinton. His name is Ray Kurzweil, so MIT. He has his own company. He takes all these pills to live it to be 2045. Once 5 milligram dose of a product replaces all these cells. So how do you explain all these results? You see, metadicol is a food ingredient, it's a lipid. It goes into the nucleus and activates the nuclear receptors. This is where the nucleus is. And these are the 27 nuclear receptors, like you have a thyroid receptor, estrogen receptor, and so on, for which tests are known, who have known ligands. And this is the entire tree of nuclear receptors. Nuclear receptor is the software of the body. All the signals go there and tell us, hey, produce this protein or that protein, and that's what happens. You need to get into the nucleus. So this is basically what we do, is the product gets in the nucleus, nano, metadicol, binds to the, in this case, vitamin D receptor or any other receptor. You have mRNA, and that mRNA translates into amino acids and proteins, and that works on different diseases. This is the concept. So basically what we have is we are sending the body instructions to produce its own drug. And you are You have a pharmaceutical company. We activate your own pharmaceutical company. You can forget the other pharmaceutical companies. And we show here nuclear receptors are expressed by us at 1 picogram in the body. So you don't need much. All the receptors are being expressed, nuclear receptors. And I just want to briefly touch on vitamin D receptor because our product is a inverse agonist. I don't want to go into it, but you can read in my publications, but it acts on the vitamin D receptor. Why is this important? Because you take cholesterol, we are trying to reduce cholesterol with statins. It goes into the skin, produces vitamin D3. In the liver, you produce 25-hydroxy. In the kidney, you produce 125. We avoid all this route by directly binding to the vitamin D receptor in the nucleus itself. And this is what we do. Either we bind to the D receptor, D binding protein, or get into the nucleus and bind to the vitamin D receptor, which then translates to mRNAs, proteins, and so on. The reason you need high LDL here is because LDL is what carries the cholesterol to all the organs and tissues of the body. Statins is a good way of killing yourself by paying the pharmaceutical companies money. Why is vitamin D important? I don't have to tell you that. In India, we have 75% of the people with low vitamin D. And I tell the people in India, in IIT, we used to have a joke, Fukat ki baat hai, it's free of cost, you get it in India. And you need to reach over 100. And that is why the beggars didn't get COVID. They were all sitting in the sun. All the Mumbaikars should go and sit in the sun by Marine Drive and there would be no COVID. And why is it so important? Because every cell in the body has a vitamin D receptor, be it neutrophils, basophils, and so on. It's there for a reason. And every organ, skin, brain, spinal cord, there are vitamin D receptors. And we also done the RNA sequence study. I won't go into it, but a lot of genes were expressed. We have analyzed this. We have not published this work, but you see the number here. The number of diseases that covered by the gene expression was 4,955. And I told you the temple in India is 4,448. And this number is a little high. That's because the people have named disease after themselves. And when we remove all the named diseases, I get 4,448. That temple, I don't know how they got that number, but I know how I got my number. And it affects all the chromosomes. We know exactly where it is being affected, which chromosome, what are the sequences, all this we have. And this is what it looks like. Hopefully one of these days I will print it a 30 by 20 feet poster where all the gene expressions are known. So for example, when you take Metodicol, there are 242,000 gene-to-gene interactions, whereas metformin, there are only about 800. Now you see why metformin doesn't work in diabetes. And this is the key. All microbes, what they do is they know that vitamin D is with innate immunity. They go and block the vitamin D receptor, every one of them, so that they can multiply. So there's no first response from our body. Metodicol basically displaces the bacteria and reactivates the immune system. And this is known, this is published work, how it downregulates vitamin D receptor, Epstein-Barr virus, HIV. HIV, the VDR is completely blocked 100%. And this is how the homeostasis is reached. The most important pathway, and I've not gone into, is the cholesterol pathway. It produces lipoic acid, which produces ubiquinone. And we know we produce GSH. We know we produce ascorbic acid. Vitamin E we have present in our body in the formulation. So this cycle is complete. And therefore, you have very little of inflammation. And we also program cells. This Yamanaka got the Nobel Prize in 2012. He took fibroblasts, took these 4 gene sequence, put it into some kind of virus, and forced the cells to produce the factors. What we can do simply here is to take 1 drop, 1 picogram of a product into any cell. It produces the Yamanaka factors. Once you produce Yamanaka factors, you have induced pluripotent cells, and they can become any kind of cells. This is the interesting part. So we can we have published this work. We can actually repair heart. And if any of you are interested in trying and taking photographs, please talk to me or talk to Mr. Sharma. And we also express CD34, which is involved in regenerative medicine. And I want to come to the second aspect of our product, which is the temple in South India. didn't tell us how they made the jaggery. And Dr. Jorge Gonzalez, who may be listening in from Colombia's families in the business for 107 years, produced a crystalline jaggery. This contains my product polycosanol in it, and its glycemic index is half of it. Unfortunately, we can't get it in India because they don't allow import of a product, but it reduces blood sugar, believe it or not, and also reduce HbA1c, and also controls your hypertension. This is the holy grail. If India allowed import of this, we could cure diabetes and hypertension in no time. But this is available. So this completes the story of Vaidishwaran Temple. They were right 5,600 years ago. And next time you have mythologies, please understand that some of it is real. And nothing in biology makes sense except in the light of evolution. And this is the key thing. 90% of our body, 99% of our body is water molecules. And my product is also 99.9% water molecules. We follow the law of nature, not the law of man, of double-blind studies and so on. So basically, we have produced a drug which probably works on every disease. We have done over 400 different diseases, by the way. And so we basically captured the sun in a bottle of nanosoma. And this is a partial list of diseases we've done. This is, I don't have to tell you. It doesn't. We are not interested in disease at this stage. We improve immune system. The body does the rest. The body is capable of healing itself. That's what is called the placebo effect. And this most Indians should know this. And to me, it's a very impressive statement that we have already discovered this. I don't know why we are imitating the West. This is my experience after 50 years. The most important statement here is when a problem is too complex, the solution is very simple. This is what Albert Einstein said, and I think I've shown you the simple solution. And this was in 1972 when I graduated. Undo, redo is all we do. When Indira Gandhi, I got the degree from her in IIT Bombay convocation about talking about Indian science in 1972. So with due apologies, Mrs. Gandhi, undo, redo is all we did. This is the path that led me to Metadicol. This is what we all need to do. This is all about a journey from healthcare to scared healthcare to self-care. And it's available in India today. You can start using it. If you have any questions, go to nanosutra.com or Murali Sharma here. And with that, I thank you for your attention.